right, so we are going to do spinal cord anatomy, and then we will finish up with chapter 12. All right, so the spinal cord does continue off of the brain stem. So the brain stem is going to be the midbrain, the pons, and medulla oblongata. After the medulla oblongata, this is going to be the spinal cord. So the spinal cord is basically a column of nervous tissue that extends off of the brain stem. So it does extend downward through the vertebral canal. We have a picture where we basically discuss the vertebral canal and the meninges. We've also talked about gray matter and white matter of the spinal cord, but now we're going to go into more details on the spinal cord. So this would be a cross section of the spinal cord. I'm going to be using something like this, but we're going to start with the longitudinal view of a spinal cord. So when we look at a longitudinal spinal cord view, first of all, this is going to represent my cranium. And then the opening in the cranium where a spinal cord is going to exit is going to be the foramen magnum. So our spinal cord exits through the foramen magnum. Let me find a good color marker to draw my spinal cord. I'll just use this color. So it exits the foramen magnum, and then it has an enlargement, and then it continues down, and then it has an enlargement, and then it ends, and it ends at a cone shape. So when we look at the spinal cord, we basically can look at it and we can say that it exits the foramen magnum, or begins at the foramen magnum, and it's going to end at the first or second lumbar vertebrae. So technically this would be L1 or L2, and you would have a lot of vertebrae in between. Now when looking at the anatomy of the spinal cord, we do and can label these in an easy way. So this is the lumbar area. So the area right above it, which makes a cone shape, is the very end or tip of the distal end of the spinal cord, and it makes a cone shape. So we call it the conus medullaris. So the very end of the spinal cord is right here, and it makes a cone shape. So we call this the conus medullaris. This is the very end of the spinal cord. Now, the area that's right above it is an enlargement, So we call this the lumbar enlargement. The region above the lumbar is the thoracic. It's not enlarged, so we just call it the thoracic region of the spinal cord. And then the area above that is called the cervical enlargement. So I ran out of room, so I'm going to draw this again. It's good practice anyway. And I have other things that I would like to talk about on it anyway. All right, there's 5 lumbar vertebrae. I'm going to draw them on here. All right, so when we talk about the spinal cord, I could say, what is the end of the spinal cord's name? Right here's the end. It makes a cone shape. So that is the conus medullaris, and it ends at L1 or L2. Okay, the enlargement above the conus medullaris is called the lumbar enlargement, and then you have the thoracic region and the cervical region. Well, I have other things to talk about. Where does it exit? All of those things could be on here where I could ask. Now, when talking about the spinal cord needs to be anchored, so it can't roll up the cavity, the central vertebral canal, but it also needs to be anchored side to side. So the first thing that I want to talk about is an extension off your pia mater. So if you are color coding it with this, your pia mater has extensions off of it called the choroid plexus. These are from the pia mater that produce CSF, but from your pia mater, you have a piece that goes down and anchors it to the coccyx. So an extension off the pia mater that anchors the spinal cord to the coccyx, which is here, is called the filum terminale. This pink. It is off of the pia mater. It is called the filum terminale. So when we talk about the filum terminale, it is an extension off the pia mater, which is a meninge, which is going to anchor the spinal cord to the coccyx. Now, another extension that comes off of the pia mater, you can see in this view. So your pia mater has 3 extensions. The choroid plexus, which produces CSF, the filum terminale, which comes off of the pia mater. But when you're looking at it from a cross-section view, coming off the pia mater, so we can actually, highlight these. Coming off the pia mater, going through the arachnoid space, through the dura mater, going out this way, on either side is another extension of your pia mater. This right here is called your denticulate ligament. the denticulate ligament comes off the pia mater. So this is an extension off the pia mater that anchors the spinal cord to the vertebral canal. But these are going to go sideways, denticulate ligaments. It's an extension off the pia mater. But you also have this filum terminale, which is also an extension off the pia mater, which anchors it longitudinally. In a cross-section way, your denticulate ligament is going to anchor it and prevent the spinal cord from moving side to side. This is going to prevent it from going up and down. So, when we look at the spinal cord, we should say that it exits the foramen magnum. It's got a cervical enlargement, a thoracic region, a lumbar enlargement, but it ends at the conus medullaris at L1, L2. Now, coming off the conus medullaris is an extension off the pia mater, which is going to anchor the spinal cord to the coccyx. Now, at the same level, you're going to have a lot of nerves that come off right around this filum terminale on either side. This is going to be called your cauda equina. The word cauda means tail. Equina means horse's tail. So it literally means horse's tail. It kind of looks like a tail. It's not the real name, it's just what it means. These are going to be roots of lower spinal nerves that come off the spinal cord. Now, when we look at the spinal cord, which is this, is going to give rise to spinal nerves. Spinal nerves, however, are part of the PNS, so we will cover those in the next chapter. So coming off of the spinal cord, you're going to have spinal nerves. So I'm not going to do a whole lot of anatomy on here, but the one that we do want to talk about is the cauda equina. Now, this is a longitudinal section of a spinal cord. We could also cut it in half, and this is what we call a cross section of the spinal cord. So the cross section of the spinal cord is anatomy that you need to learn as well. So when drawing the spinal cord, to know anterior from posterior, you always are going to draw a fissure and a sulcus. This is how you know anterior from posterior. Now we learned that there's gray matter, which looks like a butterfly. In the center of your gray matter is your central canal, which is going to contain CSF. So I'm going to fill that in yellow. So this is a cross section of spinal cord. This is a longitudinal section. All right, to know your anatomy of a spinal cord, you always look for your sulcus and your fissure. That is how you know anterior from posterior. So when we talk about the spinal cord, we basically are always going to start with the posterior median sulcus. Posterior, it's in the back. This is always going to be how you anatomically figure out where you are. Posterior, it's on the back side. Median in the middle, and sulcus means it's a shallow depression. Now the front is always going to be the anterior because it's in the front, median because it's in the middle, and it's a deep depression or groove, and that is your fissure. That is how you know anterior from posterior. Now all of this is called your white matter. Anything in the center is called your gray matter. So you can actually take pencil and you can color in your gray matter. Doesn't even have to be perfect or in pencil as long as you understand it. And I do think you create neurons by drawing this out. You learn it a little better. All right, so we're going to be talking about the gray matter. When discussing gray matter, the gray matter is the butterfly. We know that it is neurons. We are going to call these horns. So if you know this is the posterior median sulcus and this is the anterior median fissure, then basically you can label your horns. So gray matter is going to be called horns. So this is your posterior gray horn. This right here is your lateral gray horn. And anterior, this is your anterior gray horn. Easy. That's your gray matter. Now, the space above and below the central canal is going to be known as your gray commissure. Basically, this is how your left and right spinal cord is going to communicate. Think gray commissure for communication. So this would be the posterior gray horn, the lateral gray horn, and the anterior gray horn on the left side. So it's mirror images just like in the brain. Now, your white matter. Your white matter is going to be known as white columns. White matter is always called columns. Sometimes they're called funiculi. I like the word columns. So this would be your posterior white column back here. Here would be your lateral white column. And at the front, this would be your anterior white column. That is a cross-section of the spinal cord with gray horns and white columns. Now, coming off of your spinal cord is going to be 31 spinal nerves. So I need to cover spinal nerves a little bit. So we're going to draw this same picture. We're not going to label everything, but we're going to talk about our spinal nerves. Now, we can label the center section as your central canal. Your central canal is yellow because it contains CSF. All right, so continuing this cross section of a spinal cord. All right, so we're gonna do it again. We're talking about the spinal nerves that come off of it. So spinal nerves come off the spinal cord. So we're gonna do a cross section of the spinal cord. Which gives rise to spinal nerves. 31 pairs. You always start with your butterfly. You don't have to draw it perfectly. You can take a pencil, do your gray matter, which are called horns, your posterior gray horn, your lateral gray horn, your anterior gray horn, your gray commissures are above and below the central canal on both sides. So, your horns are going to give rise to your spinal nerve roots. All right, so on the posterior side, and how you know posterior from anterior is the posterior median sulcus and the anterior median fissure. That's how you always know your anatomy. So your posterior median sulcus is going to be close to your posterior horn. Your anterior median fissure is going to be close to your anterior horn. Now, when talking about spinal nerves, we actually start with something called rootlets. Rootlets are a little tinier. So your posterior horn is going to give rise to your posterior root, and there's going to be a swelling, which is going to be called your posterior root ganglion. Now your anterior horn, your horns give rise to your roots of your spinal nerves. First, you're going to have little rootlets that come off, and then these are going to branch into your anterior root of your spinal nerve. So your spinal nerve is going to have two roots. You've got your posterior root and your anterior root. It's going to happen on both sides. See if I can draw this and make it look right. Both sides, 31 pairs. All right, when looking at a spinal nerve, spinal nerves come off your horns. So the first thing when looking at a spinal nerve is we call these tiny roots rootlets. So this would be your posterior rootlets. Think of piglets as tiny pigs. These would be your anterior rootlets. So we say that horns, which is the anterior and posterior gray horns, give rise to anterior and posterior roots of spinal nerves. So the anterior rootlet is going to become one, and we call this the anterior root of the spinal nerve. This side over here is called the posterior root of the spinal nerve. Now, you can see it better on this side. When you have a swelling in the PNS and a group of neuron cell bodies, this is called a ganglion. This right here is called the posterior root ganglion. So we've learned that a ganglion is a swelling. The posterior root ganglion is a group of neuron cell bodies that are going to be found in the PNS. So spinal nerves are part of the PNS. So we could label these things as well. Posterior rootlets, anterior root, posterior root ganglion because it's a swelling, and then posterior root. And then when they come together, this is a spinal nerve. The anterior root and the posterior root become spinal nerves. Now, why these are important? When we talk about bundles of axons in the PNS, they're called, or in the CNS, they're called tracts. But when we talk about bundles of axons in the peripheral nervous system, they're called nerves. So now we can basically take the safety pin cycle and say how it ascends. What I mean by that is your sensory neurons always are going to travel up this posterior root. You're going to have a lot of interneurons. So right here, a ganglia, we learned is a swelling. In the PNS, nerves are part of your PNS. A ganglia is a group of unipolar, which are sensory, neuron cell bodies. So sensory, this is a unipolar neuron. We also say a ganglia is a swelling, but sensory neurons have to have a way to travel to the brain and spinal cord. We've learned this over and over and over. Now we're just putting the actual anatomy to it. The safety pin cycle. Sensory neurons are going to travel to the brain and spinal cord through sensory neurons. To the brain and spinal cord. So, sensory neurons are always going to travel on the posterior aspect of a spinal nerve. This is a unipolar neuron. So what happens is it synapses. It ends in the posterior root. So now we can say that sensory neurons are in the posterior root of spinal nerves, always posterior. And motor neurons are always going to originate in the anterior horn. They're going to travel out through the anterior root. So they're going out. So motor neurons are always going to be in the anterior root. It's always been sensory neurons and motor neurons. So what's the name of the neuron found in the CNS? So I shouldn't have used green, obviously, because I like to use green right there. But what is the name of neurons that are found inside the brain and spinal cord? This would be an interneuron. Interneurons are found in the spinal cord. This whole thing is the spinal cord. So basically the last part of your chapter is talking about the spinal nerve. Motor is always going to travel out of the spinal cord through the anterior root. Sensory is always traveling into the spinal cord. This is going into, this is a unipolar neuron. That's why this is a ganglia, and it's going into the spinal cord. Motor neurons are always going to be exiting the anterior root. Now there's a lot more information on that, but basically what I want you to know is the posterior side is for sensory and the anterior side is for motor. So we're about to go over a bunch of spinal nerves, but this is basically the rest of the chapter. So we did a cross section, and now we're talking about the roots, the spinal nerves. So a little anatomy there.